I want to assure Nigerians that the government will continue to ensure that great numbers of Nigerians have access to quality basic health care services.
That was President Muhammadu Buhari's promise to Nigerians in January 2017 to revitalize 10,000 primary health centers across the country and avail poor Nigerians with affordable health services. The plan was such that the Nigerian government will select one health center in each of the 109 senatorial districts, meaning 3 in each state and 1 in the Federal Capital Territory. In December that year, the then Minister of Health, Isaac Adewale, said the federal government initiated a 28 billion naira health fund to be rolled out in 2018 for this purpose. But 4 years later, some centers in Borno, Nasarawa, Ebonyi, Ondo, Kano, Benue, Niger, and Kaduna states, visited by Premium Times, are in a sorry state as Nigerians suffer the consequences. When Premium Times visited the primary healthcare center in Kantami in September 2021, during the rainy season, the reporter's first sight was a 4-year-old boy carrying a black bucket on his head as he meandered through a large pool of stagnant water from which he had just fetched at the front of the health center. There was a second entrance, a broken fence surrounded by outgrown grasses and filthy latrine toilets at the corner of the center's premises. Inside the facility, ceiling boards are dangling from the top, while some pieces litter the floor in different corners of the building. In the wards, most beds either had worn-out mattresses or were without one. The toilets in the facilities were covered by cobwebs and dust. The facility is without water and electricity since their generator developed a fault in 2016. The only presence of water is the stagnant pool surrounding the facility, caused by lack of drainage channels, which breeds mosquitoes during the rainy season and leads to one of the major sicknesses in the community, malaria. According to Maria Umar, the head of maternity unit in Kantami Primary Healthcare Center, pregnant women in the community are regularly ill with malaria, which she said leads to complications during pregnancy and as a result makes at least 25 pregnant women die annually in the community.
If we combine children and pregnant women, let's say it's more per year.
Yes.
It's more than 20 per year.
In addition to malaria, cholera outbreak in Kantami is alarming.
In a week, we can get cholera cases 50 to 60. Here in our health facility, it's only 15 deaths here. But outside in the community, there are many, more than 100 people dead.
At Dangeshulu local government area, the primary health center there is also in a similar situation. You will first find almost falling rusty ceiling materials hanging at the top, patients sleeping on the floor, and worse still, cracked walls and an almost collapsed building. So you feel like the building can collapse anytime?
Anytime. We don't have an ambulance. We need to repair patient from there to there. In the case of, in the matter of this repair, some of them they don't have money to take motor from here to Sokoto. So in that process, some of them used to die.
Also there, health staff use their salary to purchase medical supplies for patients, despite being owed or partially paid since 2015. The injections and all the things you use in the hospital, do you have them?
No, we used to buy it.
Did they provide money for those things?
No, they do not provide anything to us.
So you use your money to buy those things?
Yes, we use our money to buy.
So what are the things that you use your money to buy?
Like this syringe, this small medicine, like amoxicillin, ampicillus, flagyl, paracetamol tablet and syrup, and this small medicine, and drip.
Freedom of Information Act requests sent twice to the National Primary Healthcare Development Agency on the issues were received but ignored. The Sokoto State Executive Secretary of Primary Health Center Development Agency, Adamu Romo, referred the reporter to the State Commissioner of Health, who is said is responsible for questions regarding the construction and renovations of PHCs. The State Commissioner of Health, Ali Inami, did not reply to calls and messages sent to him. Health workers in both primary healthcare centers appeal to the Nigerian government to urgently intervene in their facilities and provide adequate welfare for the staff.